The biggest extraction of them all. That's what dentists are accusing Medicare of after receiving demands for the repayment of about $10 million for incorrect paperwork. Dentists fear it's a bid by the government to close the chronic disease dental scheme by stealth because it's gone massively over budget.
Somebody said to me, you need to turn all that negative energy into something good. So at 3 o'clock in the morning I wrote a song called Medicare Blues, and a couple of weeks ago we got together and within about half an hour we'd knocked up a tune and put it on YouTube.
After a lengthy battle with Medicare, dentist Wilma Johnson has decided to blow the whistle on what she believes has been a denial of natural justice by the federal authority.
The losers are the patients. They've got nowhere to go. And the losers are also the dentists, who are now going bankrupt.
Dr Johnson has been ordered to repay Medicare almost $25,000 for services she performed on patients under the CDDS, the Chronic Diseases Dental Scheme. Not because the services were unwarranted or invalid, but because the correct paperwork wasn't completed.
I was unaware of 2 paperwork requirements which they now say I had to comply with for my dental work to be valid.
Dr Johnson didn't write to the referring doctor to say what the treatment plan for the patients would be before beginning treatment. Neither did she give the patient a quote.
I said to him, if I'm bulk billing everybody, it doesn't cost them anything. Why do I need to give them a quote?
Dr Johnson blames Medicare for not properly educating dentists.
We did not know about the paperwork. Most dentists didn't know anything about the paperwork until 2010, which is when I wrote to Nicola Roxon about the problem, and I don't remember seeing anything until 2010.
Which is after you've been audited?
Yes.
In a submission to the Senate, the Australian Dental Association has labelled the behaviour of Medicare reprehensible.
The auditors could certainly be being described as overzealous in their behaviour. The ADA is not happy about that.
National President of the Dental Association, Shane Fryer, says of the completed Medicare audits in Tasmania, New South Wales and Victoria, all dentists' errors have been administrative.
Out of the 100 audits that have been completed, there is absolutely no evidence of any fraud whatsoever. All the dental treatment that has been claimed for and paid for by Medicare has been provided to the patient.
Dr Fryer says it's the first time dentists have been involved with Medicare.
A vast portion of the blame should be attributed to Medicare. They haven't provided good information to the profession.
I think they realised that the budget was going to blow out.
I believe it's up to $1,000 million now. That's across the whole country. And I think the budgetary amount was around $300 or $400 million.
The CDDS provides $4,250 for dental treatment per chronically ill patient. It's not means tested.
They're looking for a way to close the scheme down and retrieve some of the money, and that's politically expedient for them to do, especially considering the scheme was put in by the opposition.
Some dentists have been sent massive demands for repayment, in total around $10 million across Australia.
I'm talking to a dentist in Victoria who has to pay $713,000. She has to pay for 6 or 7 employee dentists.
Overzealous auditing is creating a financial burden and financial stress to many practitioners who just don't have the money.
Dr Johnson says when Medicare first visited her 2 years ago, they said it was a PR exercise to make sure dentists understood how the scheme worked.
I was not given any warning that what I was giving in terms of voluntary information, with no warnings, would actually be used against me further down the track to put me into a full audit.
In its findings, the audit acknowledges Dr Johnson was not told that the information she volunteered could be used against her. The compliance officers also noted that all actual services performed by Dr Johnson were compliant. They also said that if Medicare was to seek cost recovery for administrative oversight, it could cause political backlash. Janice Jackson, who has multiple sclerosis, was one of those treated by Dr Johnson. You wouldn't have been able to afford this?
Oh no, not without this.
The scheme?
Yes.
You're in the spotlight now.
Janice used to slur her words. It made the voice normal and as it was before.
Not everybody goes to the length that you have to write a thank you card to their dentist.
But she really was worth it. I mean, she'd done so much to help me.
Patients treated by Dr Johnson were low-income earners and the average cost of treatment was about $1,000 each. I understand that in the audit they also found that in fact Medicare had not even been billed for a number of services that you had in fact provided.
That's right, that's just the way I work. I often do things for free.
So you're well and surely out of pocket.
Well, we're certainly out of pocket, especially in terms of the dentures, because when we have dentures made, it usually costs us more to have the denture made than we actually get from Medicare.
Dr Johnson will be even more out of pocket if she reimburses Medicare. As an employee dentist, the Medicare payment goes to the practice and she's paid a percentage minus costs. Despite a final demand for almost $25,000 from Medicare, Dr Johnson is standing firm.
I'm not going to pay it at this stage.
730 Tasmania spoke to a general practitioner who said it was increasingly hard to find dentists willing to take CDDS patients. After her experience with Medicare, Dr Johnson has stopped taking them.
The patients have got nowhere to go. The doctors have got nowhere to send their chronic patients. The state health services are being overloaded by the patients who would otherwise be coming to see us. And if there's any hope of a future dental scheme, well, I don't see that there isn't much hope, because the goodwill of the profession has gone, and the trust.
Stephen Driver knows all too well the pain of waiting for dental help.
The state government was going to take 2 to 5 years to do anything about it. And I think that's far too long.
Under the CDDS, he received treatment within 3 weeks.
I had 5 months of chemo for a particular sort of cancer, and I was pretty aggressive on soft tissue. My teeth were perfect, it's just that it ruined my gums, and it's not a good feeling.
The disability pensioner couldn't afford to go privately. The dentures would have cost more than $3,000 out of his total annual income of $16,000.
Getting a set of teeth, it has improved my life immeasurably. I have a lot more confidence to go out. I can eat, I can speak, I can smile.
The Dental Association is hoping for some leniency towards those dentists who have made inadvertent errors with paperwork from the federal government.
The ADA has had quite high-level talks with the government and high-level officials within Medicare, and we're certainly appreciative of those talks. They are ongoing, and certainly we are hoping to achieve an acceptable outcome. But I don't believe that it's appropriate for me to talk about the outcomes of the meetings that have occurred in private.
In a statement, a spokesperson for the Federal Human Services Minister, Tanya Plibersek, says dentists have clear obligations when making a Medicare claim and must meet all their requirements. The statement says Medicare has provided dentists and the Australian Dental Association with regular information and that it has conducted fair and professional audits.